Hey everybody, I'm Dr. Anthony Crifase, and in today's video, we're going to be talking about the causes of depression and applying functional medicine approach to this issue, this health condition. And so, if you're watching this video on YouTube, please make sure you subscribe. And if you are tuning in on Facebook or other social media, please make sure you like this information, share this with someone who you know and love who might be suffering from depression or another health condition, as we'll be talking about today. And if you have any comments or questions, just leave them in the comment section below and I'll get back with you after the video. So we have talked about functional medicine, and as we said, functional medicine really takes a holistic approach and begs the question of why someone might be suffering in the first place. And so today we're going to take an example of depression, a health condition, depression that millions of Americans suffer from, and millions of Americans are on medication for and don't have answers for as well on a daily basis. So this is an important topic and we want to talk about it today. So what are some causes of depression? Now, really quick, what we're going to do is let's talk about how someone gets diagnosed and treated with depression usually. Okay, so what happens most often is if someone has depression, first they will go to their doctor with certain symptoms, right? So the first thing that a patient will have is symptoms. Now, what kind of symptoms might you have if you suffer from depression? Well, you might have things like you're sad, you feel down, maybe you're having a hard time getting out of bed, maybe you're not sleeping very well, maybe you wake up very tired all the time, maybe you're not eating very well, maybe you're not hungry, you might feel like people can't relate to you. It's just not a great feeling. Many of us have all suffered from depression at one time or another in our lives, and so this is why we need to talk about today. So these are some symptoms that you might have, right? The symptoms that we just talked about. So what will happen now is you might go to your doctor and they might label you with a diagnosis, right? So they might say, okay, we're gonna give you a diagnosis of depression, right? So they'll say, okay, you're depressed. Okay, so then what are they gonna do? Well, they're gonna say, well, what can you do for me? You might ask, well, what can they do for you? Well, now they're gonna give you the treatment, right? And so the treatment, well, in the traditional medical model, will be a medication, right? And so that's what we're gonna be going over today. And so this is why depression is a big health concern, and many people have it. But again, we need to know, why are you having this? Why are you suffering from this? So like we said, what happens in the traditional medical route is you'll go through this order. Now, what we're gonna go through essentially what the traditional medical model will give you versus what we can give you through a functional medicine model. So the first thing that, again, traditional medicine is going to give you with this, what's the treatment, and that's what we're gonna talk about today, is a medication, right? So the first thing you'll get is a medication. And oftentimes, what is this medication gonna be? I know many of you have heard of this. It would be an antidepressant. Right, so you're gonna get an antidepressant. So this kind of sounds like it's a simple fix, right? Well, if you have this condition, let's just give you that. Let's just give you the opposite of that. And again, it's a band-aid. You need to remember this, that these things are oftentimes, they're quick fixes. And so I'm not downplaying antidepressants, I'm not downplaying medications, but again, oftentimes the first line of therapy for 99% of people is this route, when we haven't even looked at the underlying causes, which we're gonna do some of this today here. So the next thing that you're gonna get with this medication, well, the first thing you're gonna get is often side effects, right? Now, we've all heard of side effects from medications, right? All you have to do is turn on your TV and watch a commercial for an antidepressant drug or a anti-diabetes drug or an this drug or an anti-that drug. They're all anti, right? They're all counteract whatever it might be. And at the end of the commercial, you'll probably hear a voice rambling very quickly and repeating off all of the side effects, many of which include oftentimes more health conditions and health issues much worse than depression in the first place. So, let's talk about what the other options might be. So you're gonna get side effects. Now, again, side effects are never a good thing. And the problem, again, with the side effects is now you're gonna have side effects, and we see this on a daily basis. You'll have side effects, and now because of these side effects, you're going to go see another doctor for these side effects, and you're going to get another drug for the side effects, right? So we don't want to do this. We don't want to see you on 5 to 10 different drugs and not having answers and not actually progressing and getting better. Again, there's nothing wrong with medications, but if they're used properly, for our traditional healthcare model, we're trying to apply these medications to chronic conditions, and so they just don't really jive very well. because these medications are very strong, so they're very harsh, they're very hard on the body, and so they're supposed to have very strong mechanisms of action as well. So there's an old saying that if the only tool you have is a hammer, then everything becomes a nail, right? So we want to take a bigger approach today and look at this from a different aspect. So the next thing that you'll get from antidepressants is nutrient depletions. So what are nutrient depletions? Well, as the word kind of implies, they deplete nutrients in the body. Now, there's a lot of charts. You can find them online. I give them to my patients in our clinic that show all of the medications that are prescribed in the United States and the world. And remember that the United States only makes up 5% of the world's population, but we consume 72% of the world's prescription medications. So, and we're pretty low down the line in terms of health and longevity. The longevity scale, I think we're about 40th in the world. So if we're supposed to have the best healthcare in the world, yes, it's best for acute care, but what we're doing again is we're applying this type of model to these chronic health conditions, and it just doesn't work. And that's clearly the numbers show that. So you get nutrient depletions. Now, what types of nutrient depletions would you get from an antidepressant? Well, it just so happens that antidepressant medications commonly deplete specific B vitamins, like vitamin B6, B12, folic acid, right? And so this is a problem because what you actually need to resolve depression will oftentimes be vitamins. Now, as we'll talk about, one of the, depression can be caused by a serotonin deficiency. And so what do you need in order to produce serotonin? Well, you need B vitamins, B6, B12, folic acid. Won't get into depths in those, but you need specific B vitamins and correct forms, etc. And so, so what can happen is patients will get depression that may have been caused by a vitamin B shortage, which caused their serotonin to drop. And now they got depression, and now they go to their doctor and they get an antidepressant medication, which further depletes the B vitamins that actually caused their health condition in the first place. So this is the type of thinking that we need to start applying to not only depression, but really all health conditions. There's always underlying causes. There's always reasons why things are occurring, and we don't want to ignore those reasons, because when we ignore them, then other things happen that we don't want. So nutrient depletions occur, okay? And then finally, what happens with essentially doing this type of care? Well, most often, the problem never gets resolved. So the root cause, a little crooked again, forgive me today. So again, the root cause truly, it just never gets resolved. And so now these patients will be on medications, dealing with side effects, other nutrient depletions, and they may initially feel better, sure, because these medications are designed to do specific things in the body. But is the problem, the root cause, actually fixed? Oftentimes, no. So functional medicine, on the other hand, again, this is the traditional route that people will often take. Functional medicine, on the other hand, again, we want to look at why. We want to ask the question of why someone might be having depression. So here are some of the common things why people can have depression. And these are very common, and we see them all of the time. So what's the first one? If you can take a guess, if you guess any of these correct, kudos to you. First one might be a gluten allergy or gluten sensitivity. So gluten, right? So gluten, many of you have heard this word. Gluten-free foods are more common. I actually eat a gluten-free diet. I love it. I feel great when I eat a gluten-free diet. And there's many reasons to eat a gluten-free diet. And gluten is a protein that is found in wheat, rye, and barley. And so what gluten does is this can carve out your small intestine. So essentially your small intestine under a microscope should look like a shag rug, right? It should look like a shag rug with a lot of folds, right? Okay. But if someone has a gluten sensitivity or gluten allergy, what can happen, and this is for celiac disease, and we're not even talking about, non-celiac gluten sensitivities, which again can manifest in a lot of different things. But for celiac particularly, we'll talk about this, and people who don't have celiac, they can progress to celiac. So this is important just from a nutrient depletion and a depression standpoint, as we talked about for vitamins. So what can happen if you have celiac is these villi in your small intestine, which should look like a shag carpet, they start looking like a bare wood, hardwood floor, right? So and so what happens is this is where you absorb all your nutrients here though. And so if you can't absorb your nutrients, like vitamins, B vitamins, well, this can cause you to have depression. So that is one example of what gluten does. But what gluten can also do is gluten, say someone drinks a lot of beer or they eat a lot of wheat products. They love bread. They eat bread every single day. They love bagels. They love donuts. And what can happen is, they have developed a gluten sensitivity. Now, if you develop a gluten sensitivity, number one, there's specific gluten proteins which can actually hit the opioid receptors in the brain. And so when you eat gluten, you can feel great. And then when you don't eat it, you can feel depressed and low. It's similar to an opioid withdrawal. If someone was withdrawing from things like something like heroin, for example, so not a good thing. You probably don't want to experience the same withdrawal symptoms as a person like that. And so then what can happen is if you have a further sensitivity, well, this can now start creating antibodies, say, to your thyroid gland. And now before you know it, you might have a Hashimoto's, which is autoimmune thyroid condition. So all of these things we're already talking about just about gluten can simply cause depression, like very, very easily. So super, super common. What's another thing that can cause depression? One of the major contributors in the United States is a vitamin D deficiency. Vitamin D deficiency. There is tens of millions of Americans who are vitamin D deficient. Why? Because we sit inside a lot underneath lights. We do not get out in the sun. And so vitamin D is crucial for not only many different body systems in the body, as well as your immune function and also depression, anxiety. So, we have patients who are often come in and their vitamin D levels are so low, 10, 20, below 20 standard units there, and they are depressed. And as soon as we fix this vitamin D issue, they all of a sudden, the vitamin D is crucial in the body. So vitamin D can very easily cause depression. What is another thing that can cause depression? Antibiotics. Well, everybody's probably taken an antibiotic, right? We all have gotten sick growing up, and even now, the flu every year comes around and many people get sick. And what do? Well, they'll go to their doctor or their healthcare provider, and they will give them an antibiotic. Now, what is the problem with this? We have some major problems with this though. Number one is we're giving way too many antibiotics in today's day and age. And what do antibiotics do? Well, they're supposed to help us obviously kill bacteria and mount immune responses. But if we give them too much, these bacteria that we're trying to kill, because antibiotic means you're fighting against bacteria, these bacteria now can start to adapt to the antibiotic and they can overcome the antibiotic. And now the bacteria have built up these defense mechanisms. They've built up a fortress against the antibiotics. And now the antibiotics, they don't work anymore. And this is occurring in our day and age now, and this is called antibiotic resistance. And this is a major problem because we need our antibiotics. They're very useful for many different things, but when they don't work, we get things like, I'm sure many of you heard of MRSA. So MRSA is a super strain, and so this can cause a lot of health problems. And so that is number one problem about repeated antibiotic usage. The other thing is that antibiotics wipe out, they kill, they destroy all bacteria in your gut. Now, what is inside of your gut? Your gut is known as your second brain. Why is that? Right? You might be thinking, why is your gut known as your second brain? I thought I only had one brain. Well, it's known as your second brain because your gut actually houses about 80% of your immune system and about 72% of your neurotransmitters. Yes, your neurotransmitters aren't just produced in your brain. Your hormones aren't produced in your brain. Your immune system is not inside your brain or anywhere else. It's in your gut. And this makes sense because as I'm talking right now, my gut, again, remember, is one big long tube from your mouth to your anus. Okay, so you can think of yourself as a big walking donut. But the mouth is the biggest entryway to the outside world, to our environment. And what happens is, as every breath that I'm taking, every voice, every word that I'm speaking, I am intaking bacteria and other things in the environment. And so my immune system has to be extremely strong in my gut, my gastrointestinal system, which again starts in the mouth and goes all the way throughout the body. And so it needs to be strong to protect it from all these things. The problem, again, is that antibiotics wipe out all of these good gut flora, all of the bacteria, everything in the gut. And so again, as we produce much of our neurotransmitters, our immune function in the gut, if we're killing off all of our serotonin, all of our dopamine, all these major neurotransmitters, as well as our vitamins, minerals, and also killing off the good bacteria which naturally produce a lot of these things. This can very, very easily cause depression along with a lot of other health conditions. So again, antibiotics, very important to remember. And also remember, antibiotics treat and work on bacteria. They don't work on viruses. And so many of the flu viruses that go around, if you're getting antibiotics for this, you're not doing any service to yourself. All right, so remember, keep that in mind, that antibiotics work on bacteria, not on viruses. So needs to be different approaches taken, and there's many natural approaches that can be taken for virus treatments. So antibiotics, that can cause depression after that long explanation there. What is another thing that can cause depression? Well, as we said, medications deplete nutrients, but what is a common one that we see is a B12 deficiency. That's vitamin B12. So why can someone have a vitamin B12 deficiency? Well, again, you absorb vitamin B12 in your gut, in specific areas of your gut. And so if, say, someone's been taking a antacid medication, a proton pump inhibitor, you might have GERD, heartburn, it's called a gastroesophageal reflux. And so if you have these experience, you might be taking a Tums or Pepcid AC, whatever it might be. And so what these drugs do is they definitively cause nutrient depletions, and they cause you not to absorb and break down your nutrients. So if you have, essentially, when you have GERD, more often than not, you have a low stomach acid. So what these drugs do, and what these over-the-counter medications do, is they will actually just buffer, they neutralize the stomach acid. So now you're not experiencing that. And what this does is, this prevents you from breaking down your food, breaking down your proteins, your amino acids. Now, where does vitamin B12 come from? Well, it comes from the food that you eat. So if you're not absorbing these things, this can cause a B12 deficiency and therefore depression. Again, remember, these are major causes right here. So we need to remember that this is the question why we ask why. And this is why we take our time with our patients. We need to listen to our patients and understand their history, their full history, what might be actually causing this. Because nobody wants to go through life with a health condition not knowing why. We all like to know why we're doing what we're doing. It's very hard to go through life to do something and just do it over and over again, and we don't know why we're doing that. We like to understand why from a logical perspective. So, major point there. What's another one? Another one is an omega-3 fatty acid deficiency. So, why can someone get an omega-3 fatty acid deficiency? Well, perhaps they hate fish. They don't like fish at all, and they have a severe omega-3, or they don't eat a lot of foods that will give them a rise in omega-3s, right? There's many different foods that can give us increased omega-3s, whether they come from fish, animal protein, land animal protein source, as well as things like flaxseed, chia seeds, etc. And there's different conversions of all that, which we're not gonna go into today, but there's things that can give you an omega-3 fatty acid deficiency. Now, how can this cause depression? Well, in the body, if we are deficient in omega-3s are anti-inflammatory. So by meaning that they're anti-inflammatory, they don't produce inflammation. Now, what does inflammation do? Well, inflammation, and if we have omega-3 deficiency, you can bet that it's not just inflammation, again, as if you get a paper cut, and you have a little, a red, obviously a cut, and it gets red, maybe swollen, etc. It's bleeding, it hurts, right? That is a localized inflammatory reaction. If we have an omega-3 deficiency, and with all chronic health conditions, these are characterized as systemic inflammation affecting the whole body. So if we have omega-3 deficiency, this can cause systemic inflammation. Now, if we have systemic inflammation, this means that we're having brain inflammation. So if you have inflammation in your brain, this can very simply cause depression, anxiety, brain fog, many, many different things. So again, omega-3 deficiency can cause depression as well. What is the next one? Maybe somebody loves fish, right? Maybe they love fish. They eat sushi way too often, and they've actually developed a mercury toxicity or mercury poisoning. Well, this can cause depression. Mercury is very toxic to the body. It will disrupt regular mineral processing, and it'll displace specific minerals and nutrients in the body. So this can very simply cause depression. And then finally, what is one last cause that could cause depression? Well, the standard American diet is not only high in omega-6, which is pro-inflammatory, but it's very high in sugars, processed foods in general. And so what do these things do? Well, processed sugars they will spike blood sugar. They will spike blood sugar and they will spike insulin levels. So what's the last thing that can cause it? A high sugar diet. So a high sugar diet will raise your blood glucose levels, which will cause your inflammation, your insulin to spike, and which is inflammatory. Insulin is inflammatory. And so what this can cause is you would have highs and lows and highs and lows. And this disrupts, again, the microbiome, all the bacteria in your gut, and this can cause depression as well. So as you can see here today, there's a lot of things that can cause depression. And this is why, from a functional medicine perspective, and this is just one, small list. There's many, many different things that can cause depression. And this is why we take a big picture approach. As you can see, if we're looking at depression from a very narrow-minded and a myopic viewpoint, we're going to be missing all of these things. And so an antidepressant medication is not going to fix any of these things right here. So this is truly, these are the root causes. And so this is truly what needs to be looked at. So I hope you enjoyed this video today. Again, if you're watching on YouTube, please make sure you hit that subscribe button. If you are tuning in on Facebook or other social media, make sure you share this post. If you know someone who's suffering from depression or another health condition, please share this information with them. Like it. Again, if you have any questions, comments, just leave them in the box below. I'll get back with you. And we want to help as many people as possible. Our mission is to help 100 million people. So by sharing this information, giving this to people, you can help us do that. So again, I'm Dr. Anthony Crifase. Thanks for watching this video and have an amazing day.